call this to order. Calling this to order. Thank you. Hello, everyone. Thank you for being here. My name is Lee Finke. My pronouns are she, her. I represent District 66A. Today is a historic moment at the Minnesota legislature. As a trans woman and the first trans representative at the legislature, as a member of the Queer Caucus, many of whom are standing here with us today, we have a responsibility to create more space for our community to live their fullest, authentic lives without fear of violence, rejection, abuse, or political attack. That is the work we are here to do today, and I am beyond excited to pass the Trans Refuge Bill off the House floor with my DFL colleagues. HF 146 would make Minnesota into a trans refuge state, protecting trans people, their families, and medical practitioners from the legal repercussions of traveling to Minnesota to receive gender-affirming care. Gender-affirming care is life-saving health care. Withholding or delaying gender-affirming care can have a dramatic impact on the mental health of any individual who needs it. Rates of depression, suicide, substance abuse are dramatically higher in transgender and gender-expansive individuals who lack access to care. Ending gender-affirming care once it is underway, what is called forced detransition, is a violence against my community that I can barely begin to imagine. That is what is happening in states across America. We have seen a wave of legislation targeting trans folks over the past couple of years, including efforts to restrict and criminalize life-saving gender-affirming care. In 2022, this included states like Texas investigating supportive families of trans youth, Florida taking action on care standards through its state medical board, and multiple states proposing bans on gender-affirming care for trans individuals and their families. The situation in our region is rapidly evolving as this harmful legislation advances. Just last night, Iowa's governor signed their gender-affirming care ban into law. And South Dakota did the same only weeks ago. North Dakota is pursuing the same cruel agenda. While anti-transgender and anti-LGBTQ plus legislation by extremist Republicans continues to rise across the nation, Minnesota has the opportunity today to boldly say that trans, gender-expansive, two-spirit, non-binary people will continue to be an integral fabric of our society and that you belong here. To all those families across the United States that are afraid and wondering where they can go for help, Minnesota is saying, we see you, we love you, and you belong here. I'll pass the mic to Dr. Gepford.
Thank you. Thank you, Representative Finke. Good afternoon. I'm Dr. Angela Cade Gepford. My pronouns are they and she. I'm the medical director of the Gender Health Program at Children's Minnesota. I need to first start off by thanking Governor Walz and Lieutenant Governor Flanagan for the recent executive order protecting access to the gender-affirming care that our patients need and deserve. And I also need to thank Representative Finke for bringing us here today to talk about taking the next urgently needed step by passing the Trans Refuge Bill. At its core, gender-affirming care is about listening to and supporting trans and gender diverse youth and their families and providing them developmentally appropriate mental and medical care. To put it simply, gender-affirming care is health care. It is life-saving, specialized, evidence-based health care that has been proven several times over to improve outcomes for youth who can access it. But the truth is it's already hard for transgender and gender diverse youth to access gender-affirming care, particularly in large and rural states across this country where now this care is being politicized and banned. A report released yesterday by the Human Rights Campaign indicated that more than half of trans youth ages 13 to 17 have lost or are at risk of losing access to age-appropriate, medically necessary, gender-affirming care in their state. At Children's Minnesota, we've already received calls from families in other states asking that we see their kids, families in states where bans have passed, like South Dakota. and families in Iowa who, as Representative Finke said, their ban was just signed into law last night. These families are scared. They are desperate. They are willing to do anything they can to protect the health and well-being of their transgender children. There is an urgency to their calls that is heartbreaking. And I worry about them, but I also worry about the youth and families we aren't hearing from. Bans on gender-affirming care are creating geographical disparities where the most privileged become domestic refugees fleeing their home states to access health care. And those families who already struggle to access health care due to racial and socioeconomic barriers, they're left without any care at all. As a country, we are literally legislating health disparities into law. Families should not have to move or even drive hundreds of miles from home to access the care they need. The ability to access health care that is proven to help kids thrive cannot and should not depend on the state you call home. Transgender and gender-diverse kids and their families exist everywhere and deserve access to the health care they need everywhere. And until that happens, here in Minnesota, we need to provide a safe haven where all kids and families know that they belong. To the trans youth who are listening, you deserve better. Today in Minnesota, the grown-ups are gonna get it right. Today in Minnesota, we are gonna legislate science, we are gonna legislate belonging, we are going to legislate love and support instead of hate. Now is the time to pass the Trans Refuge Bill and show our incredible trans youth and their families in Minnesota and across the country that we are standing up for them. Now I'd like to turn it over to Jess Braverman, who is the Legal Director of Gender Justice.
And thank you for everything you do, Dr. Gepford. My name is Jess Braverman, and I'm the Legal Director at Gender Justice. We're a nonprofit organization here in St. Paul dedicated to advancing gender equity through the law. 30 years ago this month, in March 1993, Minnesota lawmakers passed a historic bill making us the first state in the country to expressly protect transgender people in a state-level human rights law. That's the Minnesota Human Rights Act. But while Minnesota has continued to make progress when it comes to protections for transgender rights, for health and safety, it has been absolutely devastating to watch politicians relentlessly attack those rights and the individuals and families they protect in other states. That's why I'm here today to urge you to keep fighting to ensure that Minnesota is safe and welcoming by passing the Trans Refuge Bill. It's almost impossible to overstate the harm that anti-trans laws in other states can do to young people and their families. Right now, transgender kids are being pulled off of life-saving, gender-affirming care by politicians, and families are being threatened with separation by their own states. Parents are being forced to make the impossible decision between staying in their homes and risking their child's health, safety, and in some cases lives, or uprooting their lives and relocating, often at great personal cost. We can do our part by making it clear that if families move here to Minnesota, they and their children will be protected by law. The protections outlined in HF 146 are also vital for healthcare providers who can continue to provide gender-affirming healthcare to their patients consistent with best practices without fear of interference or punishment from the state. We have to take steps to protect Minnesota providers and communities to make it possible for families with trans kids to seek refuge here and to uphold our rule of law. Gender Justice has the honor of working with and on behalf of transgender youth across Minnesota. Every day we get to see the joy and successes of kids who are supported, affirmed, and loved by their parents and by their communities. We envision a future where this can be a reality for all kids. Thank you. And I'll pass the microphone to Kat Rohn.
My name is Kat Rohn. I'm the Executive Director for Outfront Minnesota, our state's largest LGBTQ advocacy organization. I am so proud to stand here today with so many of our good friends, our allies, our champions in the Queer Caucus, Representative Finke, and so many of our friends here as we celebrate the advancement of this important bill. Trans folks and LGBTQ folks across this country are feeling scared, are feeling worried, are feeling like there is a wave of legislative attacks. And here in Minnesota, we are doing something different. We are changing that national narrative. We are telling folks that they are welcome here, that they are beautiful, that they are perfect just the way they are, that you belong here in Minnesota. Today's bill is seeking to protect trans folks, their supportive families, care providers who are now looking to our state as one of the few places of refuge here in the upper Midwest where you'll be able to receive gender-affirming care. As Representative Finke mentioned, South Dakota and Iowa have already passed bans. North Dakota is looking at the same. Many other states across this country have taken legislative action to end access to this care, and we see that impact daily. We have people who are calling, who are emailing, who are reaching out to us and saying, can I come to Minnesota to seek care, to relocate my family, to find a place that is welcoming for me? And today's action, building on the important work of the executive order, is solidifying our reputation as a state where LGBTQ folks are welcomed, where we are affirmed, we are celebrated in every single community in this state. This trans refuge bill is necessary, it's important, and it will ensure that life-saving, evidence-based care remains accessible to everybody who comes to seek it in Minnesota. I'm so excited to see this bill move forward and delighted at the support that we're seeing for LGBTQ folks across this state. It is important that Minnesota continues to be a place of refuge. Thank you. And I welcome Dr. Kelsey Leonard-Smith.
Thank you, everyone, for being here, and mostly thank you to Representative Finke, whose incredible hard work on this bill is a blessing for all of us in the LGBTQ community here in Minnesota. I'm Dr. Kelsey Leonard-Smith. I'm a proud family medicine physician, and I'm also the interim medical director at Family Tree Clinic, where I take care of transgender and gender diverse people of all ages. I say this a lot, but caring for transgender kids and their families is by far the most rewarding part of my career. And in part, that's because they've really taught me a lot about what it means to be human, and also because I have the joy of providing them with gender-affirming care, something that makes their lives better. And when they need it, means that I get the kind of job where people go from being not as happy to doing a lot better, that I have the kind of job where people cry tears of joy in my office. And it is just horrifying to me that the state leaders in other states are standing in the way of that joy and that thriving. We all care about children. We all want to protect children and see them thrive. But preventing access to life-saving, life-affirming medical care that is based on a wealth of evidence, that is practiced in line with international standards, that seems to be the antithesis to me of supporting youth and children and thriving. And it's being done by these bullies in our state legislators around the country that are really resting on junk science and abusing their positions of power to hurt kids. And it really just breaks my heart to see that. You know, we get a lot of questions, those of us in the medical field, about what we mean by gender-affirming care, and there's not one answer to that question because it just means something so different for every single individual. For some people, it means really basic things like how to help your grandma get your name right at Thanksgiving. And for some people, it means like, where can I try on a chest binder so that I can like go to my school dance? And for some kids, it means medications. And you know, it's important to know that we always work with children and with families to make sure that we're trying to take the best care of you right in front of me right now, and you who we think you're going to be in 20 years, and trying to balance all those things. Like all medical care, it's complicated, and there's not one perfect answer for everybody. But you know, we use the medications because they work. And now, just to see that access cut off, it's really horrifying to me. We've always taken care of patients from around the states. You know, there are, like we said, trans people everywhere. And now we're getting all these phone calls from Iowa and South Dakota, Texas. We have families that have moved from as far away as Florida and Texas just to get care for their kids. And so I just am really excited, along with everyone here, that this legislation will move forward because it's thrilling, it's life-saving, and it sends a message to our kids here in Minnesota that they will stay safe here. Because the fact is that when they hear that Iowa and South Dakota are banning their medical care, that's bad for them. It's bad for adults too. I mean, it's bad for everybody to know that like who you are as a person is being legislated away around our country. And here in Minnesota, we have a long history, as you've heard, of protecting LGBT people. And I'm really excited to see that this legislation will move forward to continue that protection, enrich it, and really root it for the long term. Thank you.
Good afternoon. I'm Majority Leader Jamie Long, use he, him pronouns. And we are, unfortunately, as we've heard, seeing a spike in anti-trans hateful legislation that is being passed around the country. And you've heard some of the examples of some of our neighboring states that have passed these in recent years and this week. In 2019, nationwide, there were 25 anti-trans bills introduced in legislators across the country. And last year, there were 155 bills introduced. We are seeing this ugly, hateful wave of bills where politicians, frankly, are using our kids as political tools to divide us as a state. And in Minnesota, we're saying we are not going to stand for that. We are going to stand up for being an inclusive state where all are welcome, where all are respected for who they are and who they come to us as. These laws aren't just targeting action that is happening in their state, they are targeting action that is happening outside their state. And so just like the Reproductive Freedom Defense Act that we passed on Monday, we are trying to protect our healthcare providers, who you heard from today, who are providing necessary care to their patients in our state. Oftentimes patients who are coming from other states to receive care here because they don't have access to that care in their home states. So this is Welcome Week in the Minnesota Legislature. We are saying you are welcome here to receive the care you need. You are welcome here who you are, as you are. And I'm so glad that we were able to pass these two bills in the same week, because we know we need to make Minnesota a trans refuge state to help protect individuals who are coming here. And I just want to take a personal moment to thank Representative Finke for her incredible hard work on this bill, for taking an issue and carrying it forcefully forward to make sure that all of our colleagues understand how important this is, all of our state understands how important this is. So I don't think it's any accident at all that she's a USA Today Woman of the Year for her hard efforts. And certainly she's a rock star in my community. I've had trans youth who are my constituents come to me and say, "Oh my God, you know Representative Finke?" Because these kids finally have someone to look up to. They finally have someone who they know looks like them. And so we are going to say you are welcome here today. This is a good day.
It's such an honor to be here today with my colleagues and with the advocates. People of all ages deserve to be loved, accepted, and valued for who they are. We want to be clear that we stand with our trans community. We will support and protect them in Minnesota, and that gender-affirming care is life-affirming care. We're continuing to work to make Minnesota a more welcoming place and to promote inclusion in all areas of law. Hate has no place in Minnesota. I want to thank the strong coalition who has worked so hard to move this bill through the process, especially Representative Lee Finke, our leader here today, and as the Majority Leader already noted, Minnesota's USA Today Woman of the Year. I'm so grateful for her leadership. She's doing truly remarkable work. I'm here as speaker, but I'm also a mom, and today's my son's birthday. He's 28 years old, and I sometimes joke I'm speaker mom, and 'cause, I tell them my colleagues to eat well and sleep well and take care of yourselves. We love our children. We want Minnesota to be a place where it's really clear we love you, we care about you, you are welcome here, we want you here. So, thank you.
I think we have a few minutes for questions.
Representative Finke, Just a couple weeks ago, we were in the governor's office for the signing of this executive order on this. Why is this necessary?
Yeah, thank you for that question. It's necessary because an executive order recognizes the urgency and the immediacy of the work that we're doing, but we need to make law. Law is stronger than an executive order, and we have to be covering this gap now. This is not the last step for this bill. This bill does not become law today, unfortunately. So it's just absolutely crucial that we keep doing this work to build these protections and not worry about what could happen in the future. We need law behind us.
Jess with Gender Justice. Are you still here? Yeah. I know you were here talking about the reproductive freedom legislation earlier this week. I'm wondering if you can kind of capture how they're similar in terms of what legal matters in other states it shields from, and is it fair to say they are very similar in their scope in that way?
I think they're similar in that they're responding to a healthcare crisis that was created, unfortunately, by politicians, like a completely unnecessary healthcare crisis, where abortion and gender-affirming care are both being singled out, even though they are both common forms of healthcare. People who provide this care are being singled out for criminal penalties, and people who receive this care are living in fear right now because every day the legal landscape shifts under their feet, and they don't even know if and where they can legally access this care. I can't overstate enough what is happening. Politicians are forcibly pulling children off of medical care that they're being provided. You know, it's their parents and their doctors are saying, like, yes, let's give this kid my care, and politicians in other states are saying no. That's extremely dangerous. It's a manufactured healthcare crisis that's extremely unnecessary, and it's one that we need to respond to. Both those forms of care are absolutely legal here in Minnesota, and we want to make sure that is crystal clear, because in order to safely access healthcare, you have to feel safe talking to your providers. You have to feel safe telling people that you have that care, and if you can't do that, it complicates healthcare. And so these bills are similar in that they're trying to do just that. They're responding to a crisis in our country right now, and they're trying to create, to the extent we can, a sense of safety for folks who need that care. And unfortunately with this bill, the folks who need that care are children, and they should never have to deal with something like this.
Representative Eaton, in a couple of minutes, House Republicans are going to hold their own press conference here. And, they're likely going to say this bill could, help or could facilitate kids getting kidnapped. So I just wanted to give you a chance to respond to some.
I'm not sure, honestly, I'm not sure how this lie got started. Kidnapping is illegal. My bill doesn't have anything to do with kidnapping. I know that I've been getting emails about the kidnapping bill. I don't know what to tell you. You still can't kidnap children.
In the committee, you raised the issue of like this getting in the way of custody disputes, like you're siding with the parent who wants gender-affirming care against the parent who doesn't want it in those situations.
Yeah, so family custody is very complicated. I do have some backup on this. Family custody is very complicated. And I'm going to hand it over to Chair Becker-Finn, who every time somebody compliments me on the leadership on this bill, I think we need to recognize what our Judiciary Chair has done for this bill as well. But even in that custody dispute, there's no kidnapping, right? The word kidnapping has no part in that. So, but I would love to have Representative Becker-Finn answer your question.
Yeah, and I think folks do misunderstand. Custody statutes are complicated. If you already have a custody order in some other state, nothing that is in this bill overturns that at all. It just lays out some parameters where a person coming to Minnesota and their child receiving gender-affirming care here, we're just adding that as a factor in the overall decision. The courts are still going to make their decisions based on the best interests of the child. It doesn't change any of that. It just allows a couple places where we're acknowledging that there may be other states who see gender-affirming care differently. But this doesn't overturn any orders. It can't be used as a tool if you're already fighting with your ex in some other state. This law doesn't change. This law that we're going to pass today doesn't do anything to change that.
How does the provision, I believe there's provisions to address some of those states that want to take children away from their parents who want this. How does this interplay with that? Because I know there was some discussion about like extradition and you know, have to comply on certain grounds. As a non-lawyer, I'm just kind of speaking out of turn here, but can you explain that, please?
Yeah, so there are a couple other provisions, so those are separate from the custody provisions. There are a couple other provision sections in the bill that deal with extradition, and it's specifically saying that as a matter of public policy, Minnesota is not going to honor taking a child away from their parent because they came to Minnesota for gender-affirming care. I mean, that's the level that we're talking about, is taking children away from their parents because of something politicians want to make points on, which I'm sure you'll hear more about in a couple minutes.
So we have 4 seconds left that we're allowed in this room, so thank you for, okay, we're maybe one last question from John Croman, and then we got like an extra bit.
We just set the record straight. I think a previous press conference, someone said people under 18, persons under 18 are not getting any type of surgery, permanent surgery in this state. Is that correct? Because that's going to be brought up a lot too.
So, yeah, that's a doctor question. So what I can say is that gender-affirming care that involves surgical procedures is incredibly rare for kids under 18. We don't perform gender-affirming surgeries at Children's Minnesota, but it is a very rare thing for a child to access. The vast majority of gender-affirming care is medication-based or supportive services, as were mentioned, for families.
This way.
Thanks.